Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. Before we introduce our speakers, I'd like to briefly go over what you're seeing on your screen. Think of this as your homepage for this session's Learning Collaborative. You can resize or minimize any of these modules as you see fit by clicking and dragging them around your screen. The screen in the middle is the media player, where you will be able to view the presentation. If you're viewing on demand, you'll be able to pause and skip forward and back to review specific moments at your leisure. On the left, you'll be able to learn more about our subject matter experts and also access resources key to this collaborative's learning goals. On the right-hand side is our discussion board, where we will post regular questions so you can engage with your peers and our subject matter experts asynchronously after the event has ended. There's a brief survey available for you to complete at any time. We take your feedback seriously as we continue to improve our program for you. Please fill out by the time our collaborative ends. And finally, you can follow this link to learn more about our past and future learning collaboratives, which are available for you to access at your convenience. I'd like to now introduce today's speakers, Megan Nolan, co-founder of Makata Health, and Dr. Nikki Panich, family medicine and maternal care. Megan, go ahead and take it away.
Thank you, Symbol. Hello again, I'm Megan Nolan, co-founder of Makata Health, and we're an EHR integrated platform that's helped thousands of private practice physicians improve patient care, increase revenue, and reduce costs through patient engagement.
Good morning. I am Nikki Panich, Dr. Panich, a family physician and women's health provider in active private practice.
And today we're going to talk about patient engagement and how it can really be a superpower for your practice. By the end of this session, you should understand what patient engagement is and how it can benefit your practice, what role technology can play in engaging your patients, and some of the things that you should be thinking about in order to choose the right platform for your practice. I'm really pleased to have Dr. Panich here with me today as we cover these topics, so she can provide her perspective as a physician who's actively increasing patient engagement with her team. So let's jump in. Patient engagement refers to supporting and facilitating patients to be actively involved in their own care. And I'll be the first to say that that's an extremely broad term. And so really patient engagement can be used to describe all kinds of different activities that help patients play a more active role in their care. But what does this actually look like for an owner-operator like yourself to increase patient engagement within your practice? Practically speaking, it means rethinking one or all of the following three things. The next slide. 1, access. Rethinking the way that patients access the information and services that your practice provides. This could mean making it easier for them to access their own records, making it easier to book appointments, or even offering new appointment formats, such as virtual visits. 2, communication. Rethinking the way you communicate with your patients. Most often, this means opening up new channels of communications, things like chat, text, or email, and it can also mean communicating in other languages, or again, in other formats such as video. And finally, empowerment. Rethinking who does what at your clinic and enabling patients to share the workload. For example, enabling them to book their own appointments or complete paperwork. It could mean automating notifications that usually require a phone call or a letter, or even using AI to complete documentation so that you can spend more time with patients. There's lots of different ways to increase patient engagement, and it may even seem overwhelming, but the good news is that you can start small and still see tremendous benefits. And what are those benefits? First, there are major benefits for your patients. When patients are actively involved in their own care, it's safer, it results in better outcomes, and it makes the experience more patient-centered. On the right is just one of a multitude of studies that shows how patient engagement can actually significantly improve health outcomes, in this case, lowering HbA1c levels in type 2 diabetic patients. Second, there are major benefits for you and your team and your business. Patient engagement can increase your revenue. It makes patients more satisfied and more loyal to your practice. And it reduces your team's workloads, burnouts, and costs. Again, just picking one of many studies, this group saw over $150,000 of savings per year, and almost 15 times ROI for a telemonitoring initiative that empowered patients to collect their own data. Today, patients expect to be actively involved in their own care more and more, and it's getting harder and harder to staff traditional administrative roles. This makes patient engagement an even more compelling avenue for improving your practice. Technology is a key to increasing patient engagement, and there are lots of different kinds of technology out there. So looking at the role that technology can play, there's several key features that most of these solutions offer, and this is a great starting point for considering what patient engagement technology you might want to implement at your clinic. It can include one, many, or all of the following features. It can help with appointment scheduling and notifications. It can help with secure on-demand messaging to one or many patients. It can enable patients to complete forms, provide feedback, or take care of other paperwork. It can be used to share records, resources, and care plans with your patients. It can help with bill payments and processing. And it can even include ambient intelligence to listen to conversations that you have with patients and then complete all kinds of other documentation, such as notes, letters, and even summaries and handouts for the patients themselves. In terms of the return on investment that you can expect from patient engagement technology, it can be quite substantial. Here's looking at just 3 common features that patient engagement technology can enable. If you look at improving the way you communicate with patients by introducing a tool that helps you text, email, and automate notifications, you can see 50 to 80% reduction in no-shows. If you look at a tool that can help you reduce documentation workloads through AI, and the time savings for your providers and physicians, you can see up to 30% and beyond reduction in charting times. And finally, empowering patients to complete tasks such as appointment booking or completing forms can lead to at least 25% reduction in staff time spent on these tasks. So altogether, you can see 25 times ROI, which is incredible. And even if you only see a fraction of this, it can mean substantial improvements for both your patients, your team, and your business. But that's enough from me. I'm sure you'd like to hear from someone who's actually lived the experience of implementing patient engagement technology and taking on these kinds of initiatives in their own practice. So I'd like to turn it over to Dr. Nikki Panich to share her experience.
Thanks, Megan. So my practice, just to tell you a little bit about it, and it's outlined on the next slide, is a low-risk maternity practice. We're 7 physicians who share a patient panel. And we provide anywhere from 150 to 250 pregnancy-related appointments per week. So it's quite a busy practice. We started our technology journey, patient engagement technology journey during COVID. One of the big problems that we had was trying to still service the volume of patients that we provide care to in a safe way. And so we actually had patients staying in their vehicles until we were ready to room them, and started out by trying to do this by phoning people. And it was really, really, really taxing on our staff. The phone lines for regular appointment booking were jammed up, and it was very frustrating. And so we came across a technology that allowed us to be able to text people and to give them a notification, very quickly and easily on their phone to say we had acknowledged that they were there and waiting, and that they would receive another message when we were ready to bring them into a room. And so it's one of the blessings that came out of COVID was the adoption of new technology. It's crazy that it took a pandemic to bring my office kind of into the new century, but it did. And that was just a starting point for us. So we service a patient population with a lot of English as a second language needs, with broad social determinant needs that are often reliant on other people for transportation. And so being able to communicate frequently with them, and in many cases in a language other than English, has been significant in reducing our no-show rates, booking appropriate appointment lengths, and we'll talk a little bit more about how we did that, and also just freeing up our staff. Our admin staff, have saved upwards of an hour a day, maybe 2 hours on some days, spent, phoning and trying to coordinate care. And now that time is spent more meaningfully with people and patients and serving needs. So if you want to move on to the next slide, I'll tell you what we did. So we started by implementing Makata's solution. And as I said, we started during COVID with notifications to patients for when they were able to enter the room. It was very simple. We already had their phone numbers programmed into our EMR. And the Makata system is actually EMR agnostic. So our staff were very easily able to connect their platform to our system in a way that enabled quick SMS messaging. It was all automated in terms of what was being sent, and even the timing of reminders and frequencies. So we started with COVID, and then we moved to new patients because those were our highest no-show rates. So we moved to new patient reminders, and we saw a reduction of about 80% of our no-shows, which is significant. We only see, 6 new patients a day. So if one of those spots goes unused, it's a lost opportunity, not only for our practice, but also for that woman and the system in general. And so we found that by implementing this messaging system, that all of a sudden our patients were showing up. And that was fantastic, not only for us, but for them. And I just want to say that if people wanted to opt out because they preferred, phone calls, they could do so. But the very vast majority of people were thrilled to be getting notifications, also thrilled to be getting calendar notifications. I mean, I know more and more my life is governed by my calendar, and the ability to share things with a partner or perhaps a friend who is driving them and have that calendar invite shared with that person. It sounds like such a simple thing, but it's made such a practical difference in the lives of our patients. We've expanded over time in how we're using the platform. So we started out, like I said, with during COVID, and then we went to new patient reminders, postpartum visit reminders. Oh my goodness, if any of you have been postpartum, the postpartum brain that comes and the chaos of, no sleep. And so it's so easy to forget an appointment. So having that, 2 day in advance, 1 day in advance, and then few hour in advance reminder, if the patients want that, can be the difference between making it or not, especially with a newborn, because my goodness, can that be a taxing time. But then we moved on to another feature. And so part of the care that we provide at the maternity care clinic is we like to foreshadow what's coming in their care. So before the 36-week visit, we give an explanation of what a groupie strep swab is. And so we traditionally had done this in paper form, and they would get a little stapled booklet, at their 34-week visit, telling them what's going to happen at their 36-week visit, as well as anything relevant to that visit. And so we started moving that into a digital format. Not only are people thrilled because they haven't lost it, but we've also, done an environmental good. So we're saving trees, so that's great. But the third benefit, and this is the really big one, is that we're able to provide those instructions in simplified English as needed, but also in a variety of other languages. So my patient population, Spanish is a very common language, but so is Punjabi and Hindi. And so we're able to allow patients to receive that information in their language of choice. And this brings more meaningful discussions at the next visit because they've had time to understand and truly ingest it. And I actually think it's improved our informed consent. One of the very last things that we've implemented is a depression screening tool. And so this is one of the forms that Megan had referred to earlier. So we used to do this, and patients would come in, they would sit in the waiting room with a clipboard and would check off or circle, the answers to questions. And so what we do now is we send this out digitally in advance, and it can be done in their language of choice. And then when somebody screens high, if it's in the postpartum period, we offer them a sooner appointment if they want it. And we also offer them a longer appointment. So our staff know if somebody screens high, to double book a slot so that we have the time that we need to really address those needs. And that has made a huge difference in my day in, keeping me on time, but also allowing me to really feel like I can meet patient needs. And it's been enabled by, a wonderful technology. Next slide. So some of this we already talked about, but I have a much happier and engaged staff because they're spending their time on valuable things, like improving the care of patients, and less time, booking appointments and answering administrative type calls. I think the reason that this was so successful in our office is that the team of people involved in the implementation was physician championed by me for sure, but I would say was owned by our staff. And, really having them direct the process, provide suggestions on how, this was going to work and how this was going to function in our clinic was the key. I think the biggest lesson I learned was you need to ask the person in that role how to make their role better, because they're the one that does it. Yes, I may be the physician. Yes, I may be the owner of the clinic, but I'm not the owner of that process. And I think for me, that was a big learning. And I think if you ask my staff, they would say that, the reason that, this is their program and they're giving us suggestions as to how, how it's best being used. There's a dashboard where you can monitor, people opening the messages, are they not? Do we need to, we shortened some messaging, we changed some language, we definitely went through some iteration over time as we got better, and as we learned more about the platform. But no-show rates being reduced, people being more engaged, people asking better questions, and really being able to book our days appropriately for the patients that are going to be there. Those are the biggest benefits that we've seen.
Awesome. Thank you so much, Nikki. So with that, we wanted to cover off a bit about how you might go about finding the right technology for your practice. And I think Nikki gave a great overview of how you can start with a single solution to a single problem and really grow over time and adapt that, and really letting your team lead the way on what that can look like. So in terms of looking at technology, we put together a framework. Of course, in the healthcare field, we have to have an acronym. So this is the SPICY checklist for evaluating some of the different solutions that are out there. And really, this is just meant to be some thought starters, some questions that as you're looking at different tools that might work for your clinic, things you can ask to see if it could be a good fit. So one of the first things that you want to look at, I think, is how the technology is supported. And this comes down to the company rather than the technology solution itself. So how does this company partner with its customers? What is their approach to onboarding? Is this going to be a do-it-yourself sort of process, or is there going to be some support there? And then after you launch, what does ongoing support look like? How accessible is it? How are they going to help you out if you have questions, if you need to make changes as things evolve, and of course, if something happens to go wrong?
And this was really key for us. So I can say that we had tremendous support and still do. So we had our key person, we had our phone a friend that we knew was dedicated, to our clinic and really did understand our needs and workflow. That was so instrumental in making this successful.
Awesome. The next piece is private and secure. So this is table stakes when you're working in healthcare and you're handling your patients' personal health information. But of course, you want to check how the company approaches privacy and security, and also not just what they have in place today, but what their practices are so that they can keep up with changes. It's rapidly evolving when it comes to privacy and security. And so you want to make sure that the partner that you choose is going to be able to keep up in that space.
Yeah, and I would just say that you want to make sure that they're adhering to the same standards that you would with your EHR. So you want to make sure that they're high trust and SOC 2 and HIPAA compliant.
Absolutely. Integrated. So this is a big question, how the technology is going to integrate with the other software and even the other processes that you have in place in your clinic. There's a couple things to consider here when you're looking at tools. One approach is that you can look to piece together best-in-class solutions. This can be a really successful approach, but it relies on the solutions being highly integratable. So that includes your electronic health record as well as the solutions that you put in place. And then you can also look at all-in-one solutions that have a much more comprehensive feature set, so that you have fewer solutions to think about, to deal with, to integrate, and go from there.
Yeah, we did an all-in-one. For us, that was, having one solution that was going to meet a number of different needs was the right answer for us. But every clinic is different and every practice is different. And, depending on how diverse your needs are or how many teams you have, you may find that you need multiple solutions.
Absolutely. Customizable. So looking at how customizable the software is, having worked with hundreds of different clinics, I can tell you that there are millions of different workflows, preferences when it comes to the patients, the teams, and the physicians themselves. And so I think it's really important to look at how a particular solution can accommodate the level of personalization and variability that is needed in today's typical clinic.
Yeah, for us, language was key. And that ability, and Mekada's ability to meet that was one of the key driving factors for us working with them and continuing to do so over time.
And then expandable. So this is a piece around comprehensiveness and thinking about that idea of even if you don't want to implement all of the different solutions and workflow improvements that are possible, you want to start small, but be able to expand. What could that look like with the tool that you're considering? Does it enable you to expand beyond a single solution today to tackle other aspects of patient engagement tomorrow?
Yeah, and I'm going to suggest that you probably want to start with one and expand over time, just in terms of buy-in, but also, you celebrate the success of that win of the first, milestone that you've achieved, and then you build from there. And building those champions along the way of the staff members and the people involved in that team is going to be so key.
Absolutely. I think that's a huge tip. I think we've seen that approach really, really work well with the teams that we've worked with, for sure. And then finally, engaging. How accessible and easy to use is the technology? And I think that is both for your patients and for your team. And I would even go so far as to be asking the vendors or partners that you're considering if they have data or case studies, people you can talk to that really illustrate that level of patient and team engagement.
And if they don't have case studies, ask for reference checks. Because there's other people that have used the platform, and it can be a verbal, it can be a verbal case study. It doesn't have to be a published written one, but you want to make sure that others have been successful in using that and what their experience was during the way, because you're still running a practice while you're doing this, right? So you want to make sure that is it a doable, solution in the time frame that you're hoping. And so yeah, getting those references are going to be important.
Absolutely. So looking at that last point around engagement and why that's such an important piece is that ultimately patient experience is what's going to drive the return on investment that you're going to see from these patient engagement tools. It all starts with that patient experience, something that's easy for them to use, that draws them into the technology, because that's what's going to drive their engagement and actual use of the technology. And when you see high use of the technology, that's when you start to see the benefits in terms of automating significant workloads or driving significantly more positive patient outcomes. And that's what ultimately results in the return on investment that you're looking for. And so really the importance of the patient experience, the design of this technology and how it's going to fit into your practice can't be understated.
And is return on investments from a health outcomes perspective? Absolutely. Patient experience, which helps with, in our practice, they're telling their friends who are also pregnant about how great it was at the maternity care clinic, and this is how they send me information, and oh, isn't that cool? And so, word of mouth is also fantastic. I would say return on investment from a staff standpoint, we all know burnout rates are high, not only for physicians and nurses and care team members, but everybody that's part of that team. And so I would say we've also we've seen a return on investment in terms of staff engagement and also staff satisfaction, and that that drives retention. Anytime you transition a person in your practice, it's big. Everyone feels that. And also, as I said, I was the physician sponsor for this, but it's really my staff that have championed it, and them feeling like they have ownership in the business and they have ownership in the success really drives how successful we have been as a practice. And so it is much bigger than a financial ROI. It is, there's patient experience benefit, there's provider experience, team experience, and staff retention. I would say all of those are things that we have seen.
Awesome. So finally, just to put some practical things to consider as you start your journey, or maybe continue your journey with patient engagement and the kinds of tools that can help you with that. When you're looking at tools, some things to consider are the accessibility. So looking at things like the language or languages that can be supported, so that patients can use these tools and consume the information in the way that's most comfortable and convenient for them. And then just the basic usability. So how difficult is it for the average person to engage with the technology, to use the features? And you can use yourself, if you're finding it hard to immediately understand or use, that's a good indicator that there's some red flags here and that you're not going to get the engagement you're looking for. To further drill down onto that, with technology, there can be some approaches that use a portal or an app. That's something that the patient needs to download, register for, log into, learn how to navigate, versus technologies that provide more of a guest checkout experience. And so that guest checkout experience can be much easier for people to navigate and much more in line with the level of investment that they want to make with the technology as part of their care. And further to that, the balance that the tool strikes between the friction of validating and verifying and logging patients in versus maintaining privacy and security. So really looking for tools that can strike a balance to keep friction to a minimum, while at the same time maintaining privacy and security. So those are a couple of ingredients that make tools really easy to use. And then finally, when it comes to the reach and engagement, a couple of benchmarks to keep in mind is that you should be looking for tools that can easily reach at least 90% of your patient population through the various communication channels, things like chat, text, email. And then finally, engaging at least 60% of your patients. So that's things like having them actually book appointments, actually confirm their appointments from their reminders, or actually completing the forms and other tasks that you're enabling through the tool. Awesome. So thank you so much. It's been a pleasure to share a little bit about patient engagement, what it can do for your practice, and how technology can play a role. We'd really love to continue the discussion with you. And to kick that off, we would love to hear your stories about some of the wins that you've experienced, or even some of the challenges that you've experienced when it comes to increasing patient engagement within your practice and using technology as a part of that.
Thank you to both our speakers today for their time and a wonderful presentation. That concludes our time here. If you'd like to check out additional resources and links, we've got them here in the back, as well as other steps tools. You can follow the QR codes on the screen here. Thank you, everyone.